Session 14.4, Scapular Mobility and Muscle Performance. In this lab practice session, we will look at the mobility of the scapula as related to the flexibility of the muscles, and we can also call that the muscle length that allows the scapula to move into that normal upward rotation position. And we can look at the performance of the muscles that help create that upward rotation that is the normal occurrence for someone to do overhead reaching. So when we're looking at the mobility of the muscles connecting from the rib cage to the scapula, we're looking at the length and flexibility of those muscles, particularly the pectoralis minor, pectoralis major, latissimus, and teres major. So let's take a look at those first. So pectoralis minor.
With the patient supine, palpate the acromion and measure from the most posterior part of the acromion to the table. Normal is 1 inch. The pec minor can also be assessed by holding the humerus at a parallel to the floor position and using your palm on the coracoid process and pushing the shoulder in a posterior lateral direction with the pec minor fibers, feeling for stiffness.
So as you see, the length of the pectoralis minor is measured, is looking at the flexibility of the length of that muscle that attaches from the upper ribs to the coracoid process of the scapula. And so looking at that ability of the acromion to appear near the table, and here you see someone that has a relatively shortened pectoralis minor because his scapula is in that anterior tilt position. So you can check that by its looking at resistance. Then you can also look at pectoralis major, the clavicular fibers, and seeing can that arm come to the table, and look at the pectoralis major, the sternal fibers, and see at about 135 degrees of flexion, abduction, can they reach the table. Notice this client's, his knees are bent. That's important to put the back flat in the rib cage. And now you're looking at latissimus, how the arm is relative to the table, and normal would be for it to go back. Now part of that problem could be the muscles between the scapula and the humerus. So as you go, do you see more elevation of the rib cage, which would be more latissimus, as you move the arm to the table, or do you see more movement of the scapula relative to the humerus, which would be more indicative of a tightness between the muscles of the scapula and the humerus, such as teres major. When you're thinking about muscle performance, you're looking at the muscles related to upward rotation, as well as the muscles that create that movement of the humerus, those rotator cuff muscles, to stabilize that humerus as you're doing overhead activities. So when we're thinking about upward rotation, a big component is this muscle of the lower trapezius to be able to do upward rotation and have normal length. So you need normal length of the muscles of the front, so then the trapezius can actually give that upward rotation. And here someone's doing this wall angel test. Now we call it a wall angel because in climates that have snow, you do this on the snow and you make a snow angel, and now we're doing it with a wall and creating that picture. Now you see here that this person's as he goes up, his elbows come off the wall at about 115 degrees or so. Normal would be for the elbows to stay against the wall all the way to 180 degrees. And so he has a little bit of weakness, but it's also showing that he's got tightness in the front, and so it's hard to do It's hard to turn on your lower trapezius, your scapular adductors, when you have tightness in the front, your pectoralis major and pectoralis minor pulling you forward. Part of that is how does serratus work with stabilizing that scapula against the rib cage. So here you see a good push-up plus position, and we'll see if he can maintain that as he goes into a push-up. And so he'll do it as best he can to try to be correct, and then he will show the abnormal concept. So here he's pushing up, trying to keep himself in the push-up position. His right side is working a little bit better than his left, and now he's trying to really exaggerate that push-up plus position, and now he's going to go into just letting his scapula wing, where he's not using that. He's using his upper trapezius, but not any serratus activity. And now here again, he's trying to keep that nice abducted position of his scapula. So again, in this position, he's in the push-up plus, where his serratus are really engaged, less activity of his scaling, of his levator scapula. And then as he tries to keep himself there and just bend his elbows, he's okay. You see it a little bit, but on the left, it's a little bit high compared to the right. And then he'll exaggerate here, not doing it at all and not using serratus at all, and just using triceps and pecs to do his push-up rather than serratus. And here's he's trying to do it as normal as he can. And you see as he goes, he even gets weaker on his left, where he has a little bit of that excessive medial rotation as well as abduction of his scapula, representing, of course, weakness of his serratus with this push-up plus test. When you think about rotator cuff resisted tests, the main muscles we look at are the supraspinatus, which is an abductor, but it's an abductor at the initiation of arm elevation, so essentially at about 30 or 40 degrees, and going into this scaption movement, so it's movement of the humerus relative to that scapular plane of the acromion. And so you're giving a little bit of a gentle pressure. You have a big lever length, so you give it kind of a light pressure and see if they can sustain that and hold that, comparing one side versus the other. Same with the external rotators, the infraspinatus. You can do both at once, and then if they can do it and you can see a good comparison between left and right, you can also just stabilize one side and work the other. You can use this position to look at the biceps brachii, especially the long head, where you get some shoulder flexion as well as elbow flexion, and turning on that and see if there's any pain, and also if there's no pain, go into strong resistance and see how they can hold that, comparing left versus right or involved versus uninvolved. In this position, you can put them in the 90-90 position and look at external rotators, which would bias the teres minor. The other muscles, of course, are working, but it's where the teres minor would work largest. So maybe particularly you may find some weakness here on one side relative to the other in this 90-90 position. And again, you're using a large lever length, so it's you don't need a lot of strength to give resistance here because of your lever. So the big deal with doing these muscle tests is actually just give a very slow pressure on and a slow pressure off. And I'm going to just exaggerate that focus of, as you put him in position, you say, match my pressure, slowly build up pressure, and then slowly go off. If you go quickly, you'll fake them out, and that's not a good test of muscle. So you want to slowly give them that proprioception, build that pressure on, they can feel it. Only touch the surface of the direction that you're moving, and don't touch the underneath side, because then you'll be inhibiting. So here, when I'm doing external rotation, I'm just touching on the outside. I'm not touching on the inside of his wrist, because that would be a confusing message. And here I'm stabilizing his trunk, but I'm still just touching the outside of his wrist. Same thing on the other side. I'm just touching the outside. I'm not sticking my fingers around and touching the inside, which would again proprioceptively give the wrong cue. And going into flexion, I'm just touching the volar surface or the anterior surface to give him a good cue. Notice on the same thing, just touching the anterior surface, not grabbing the whole wrist. And then in this position, I'm going to overpress by making sure he doesn't come off the table, stabilizing his trunk. But again, I'm just touching that anterior surface of his forearm. And in this position, I'm just going to touch the back of his wrist and then see if he needs stability, but he's doing pretty good with that. He can hold that resistance pretty good, but just, again, doing some counter force so he doesn't feel like he's going to be pulled off the table. Again, touching the back. Notice just the back of the wrist. I'm not grabbing around the front. Don't wrapping my fingers around, just touching the point so he can have a good proprioception and a good cue. And when I want him to relax, I can certainly touch everything and say, hey, just relax, let your arms down, and we'll go from there. So a slow build up, slowly on, slowly off, and then touch the correct surfaces is the skill with doing manual resistance to get what you need. So time to practice. So let's do this muscle length test. Look at pec minor, look at your lats, your pec major, your teres major, and looking at, again, the tightness of the length of these muscles, and realize with moving as people have trouble with their capsules in their shoulder, such as adhesive capsulitis, which we'll learn next, that the trouble may not be muscles, it may actually be tight capsules. But let's look at, first, let's do these muscle length tests, and then in our next sessions in our future sessions, we'll look at tightness of capsules. And then when it comes to muscle performance, you've got some good options of looking at the lower trapezius and the serratus using the wall angel and the push-up plus, and then your resisted test of the rotator cuff muscles, looking for a good ability to contract, but also look at the ability to contract without pain, and so you don't have any contractile tissue pathology or problem with that, and see with a relationship between the movement and pain with adding this resistance. So go practice.